Hi Ishita, hi Preeti, hi Prabhat, Sophia, others. Thanks for joining in. So today we are having a live from the aesthetic clinics, and the live is going to be on hair transplantation. So we could talk about all things hair, but especially with surgical hair transplantation being the focus of the talk. So let's take it forwards and see what we get. Thanks to everyone for joining in. So, in general, I'll start off by saying that hair transplant surgery is considered to be the holy grail of, treating areas of hair loss. Hi, Ishita. Yes, we can do periocular aesthetics as well. Sure, why not? Some other day. So, hair transplant is supposed to be the holy grail of, trying to make sure that areas which do not have hair on the head can be reinforced with hair. In hair transplantation, we usually take hair from the back of the scalp. The back of the scalp, as we are aware, is the donor area. And this donor area, hair is taken from these parts and then is transplanted into the front of the scalp. Why is the back of the scalp important? The back of the scalp is important because the hair here do not have DHT receptors, dihydrotestosterone receptors. And because there are no DHT receptors which are available, it makes these hair able to be transplanted and then they can actually stay in place. So that's the big advantage, and that's why we take hair from the back of the head. However, taking hair from the back of the head for a hair transplantation has two major problems. The first problem is, of course, that the amount of hair which can be transplanted from the back is limited, because what is happening is you will take hair from the back of the scalp and then put it in the front of the scalp, but the hair from here will be removed with the root, and because the hair is getting removed with the root, there is no other way to replace that again. So what hair has come out of here and is being put in the front of the scalp cannot grow here. You can't have the tree growing in two places. And the second problem is there are a limited number of trees here, right? So beyond the point, if you remove the hair from here for the transplantation in the front, this gaps will start appearing in this particular area as well. So those are really the things to think about. Those are the things that we need to think about and take it from there essentially. Now, hair from the back of the scalp can be removed by two techniques. The first technique is called the follicular unit transplantation, or the strip technique, or the FUT, where we used to take a strip of hair. So you're basically removing like a garden of hair and then taking one hair at a time, chopping that up, taking one hair at a time, and that hair is being transplanted onto the front of the scalp, right? That is the first way of doing it. Second way of doing it, the advantages of a FUT, the disadvantage of a FUT rather, is that you have a large scar out here. So there's a large scar because obviously you're removing a strip of the scalp skin and that needs to be joined together. So you get a linear scar there. And so everyone will get to see that scar if ever you have to shave your head or something like that. The other problem is that the advantage rather of FUT is that you can do it much quicker. So a strip technique, you can even do about 4,000 or 5,000 hair, which can be done at any point in time. Whereas with a FUE is a technique by which we remove one hair at a time and then transplant it in the front of the scalp. So if you do that, then it takes a lot longer. And FUE, typically we struggle to do more than 3,000 grafts every single session, and that also can take up to 6 to 8 hours. So these are some of the things to remember. These are the major types of hair transplant. The other problem with any hair transplant is people tend to think that hair transplant is the holy grail. Everyone tends to suggest that we should do the hair transplant as soon as possible. Yes, these hair, they do not have DHT receptors, so they will not fall. But just because these hair do not fall does not mean that the other hair won't fall. So what I'm saying is, suppose you have natural hair, right? Suppose you have natural hair and you want to put the transplanted hair here and fill up this particular area. But the fact is these hair won't fall, but this natural hair will continue to thin out. And this thinning of the hair leads to gaps which appear within the transplant. And so one thing that is important to remember is the disease is such, hair loss or androgenetic alopecia, the disease is such that people will continue to lose hair throughout their life until they are completely bald and they are left with just a little bit of hair on the back. And so from that perspective, it's a massive problem because you will have to continually do hair transplants to fill up the gaps which appear over a period of time. Now, Preeti's question is, does it have any effect on my existing hair? Yes, it does to some extent, Preeti. Because when you are going ahead, imagine trees. If trees were being removed from, let's call this Kanyakumari and planted in Kashmir, then when you're removing the trees, you will cause damage to certain roots. Sometimes the roots can get transected. And then when you're putting them again in Kashmir, here you will be digging in order to put the roots in, and that can cause damage to the surrounding roots also. So from that perspective, there can be a damage to the existing trees as well. So FUT, FUE, we spoke about that. We spoke about the fact that we routinely need to go ahead and make sure that medicines are taken pre and post, and the process of care needs to continue. Ankita wants to know what is the success rate of hair transplant in general. Success rate is 75-80% plus, which means if you remove 100 hair from behind, 80 can be transplanted here and those 80 hair will grow back well. But the thing to remember is you're removing 100, you're left with 80, so you're actually losing 20 hair. So in a hair transplant surgery or a hair translocation surgery, as I call it, net the number of hair on your head are coming down. The location is changing, but net the number is coming down. What are the side effects or complications during the procedure? Generally, hair transplant procedures are very safe. Generally, there are not too many problems. Hair transplant procedures are really safe. But there have been a few unfortunate incidences. I can remember one from Mumbai last year and one from Chennai the year before, where people have died due to a hair transplant. Does this routinely happen? No. But can this happen? Yes. And so there is a possibility of people dying post hair transplant as well. Any surgery has risks. And even though cosmetic surgery is more predictable than any other time in human history, the risk can never become 0%. That's important to know as well. So Ekta wants to know if QR678 is best or FUE is best. See, Ekta, different strokes for different folks. It's like asking for a blood vessel which is blocked in my heart. If I'm getting a heart attack, are stents better or bypass better? Different strokes for different folks. Different patients will have different needs and different patients will have different advantages. So, and different procedures will have different advantages in different patients. For early hair loss, QR678 is great. But if you have grade 7 alopecia, even though we have enough and more patients with QR678 who've responded, in whom even grade 7 alopecia has responded, the fact of the matter is that in some places, especially if it's a limited area, it might be better to do a transplant. So some patients need QR, the early patients. Some later patients need transplant. And most patients, even after the transplant, need the QR to keep the transplanted hair on the head. So it's a combination of therapies which really works well. Anuvita wants to know how to evaluate a patient for hair transplant versus hair rejuvenation. It's actually the same, Anuvita. It's different stages in the same life cycle. Hair rejuvenation is something that we want to use for women, primarily women who've had salon damaged hair or women in whom there's a slight amount of thinning and they want a little bit more thickness. We would call it hair rejuvenation. So non-surgical procedures work really well. Hair transplant is for much more advanced cases where rejuvenation may not be possible because all the hair follicles are already dead. So that's how you will evaluate and figure things out. I already answered that, Sakshi, the possible side effects or complications during the procedure. Scars not healing, scar from the transplant itself. The donor area is limited, so you can't keep doing transplants repeatedly. Possible side effects have also included death. I mean, sometimes, very rarely, that can also happen. Infections are a common problem. Crusting is a major problem. Itching and falling out of the natural hair after the procedure, called telogen effluvium, because of the shock caused by the surgery. These are all possible side effects and complications. So that's a great question by Usha Rana. Why did I lose so much hair after I had GFC treatment and I didn't want to go back? See, GFC is actually an improved version or a more later version of PRP, which is platelet-rich plasma. Most patients don't know, and most doctors also don't know. PRP actually has both positive growth factors and some negative factors for hair growth. So in some people, PRP works well for causing hair growth. But in some people, because of certain down regulation of certain other receptors, it can also cause a problem and cause hair fall as well. Plus, in my opinion, PRP or GFC are like a horse. And why would you want to use a horse when you have a car like QR678, which is far more advanced, is a question that I always have in my mind. So Srujan Shinde wants to ask how many QR678 sessions are needed to see the results. Typically 5, Srujan, for early hair fall. So 5 sessions of QR, each done 3 weeks apart, which is 15 weeks of therapy for early hair fall or for hair rejuvenation and maintaining the hair. And for advanced hair fall, 5 more sessions are recommended, which is a total of 10 sessions, each done at 3 to 4 weekly intervals. So TS Rock Dancer wants to know what are the possible side effects or complications. Answered that thrice already. Preeti wants to know, in a lifespan, how many times HT can be done? Depends really. How many times HT can be done depends upon a number of factors, including the amount of donor hair. So if the donor area itself runs out of hair, then you can't do any more transplants. Like I said, there is a limited amount of hair behind. When you take the hair out along with the root, they won't grow. Those hair cannot grow back here. And so there is no option but to, have a limited number of hair removed, because if you remove too much, there will be gaps which will start to appear here. Ekta wants to know, can we take hair follicles from beard and chest region? Answer is yes, you can. That is called body hair transplantation. We can take it from the beard and the chest region, but typically the uptake from these regions in the scalp is slightly lesser than the hair which is coming from the back of the scalp. Why? Because you can imagine a cactus may not grow in a very rainy climate, and you may not have the eucalyptus tree growing in a very dry climate. So every hair has a particular cell matrix where it grows the best. Scalp hair works the best for scalp hair transplants, but you can take it from the beard and the chest region. Also, because of the difficulty of removing the beard and the chest region hair, it can also be more expensive than hair taken from the back of the scalp. Hi Vishruti. So Usha Rana wants to know, what do you suggest for regrowth? Now is it QR678? Well, the QR678 has replaced PRP in a majority of places. So at the aesthetic clinics, we stopped using PRP almost 8 to 10 years ago. And at some of the largest skin and hair clinics all across the world in 10 plus countries, QR678 is actually replacing PRP. Like I said, PRP has the problem of having to remove blood. It takes 2 hours for the entire process to be completed, whereas QR678 comes out of a bottle, and so it's a nice 30-second procedure, which is the good advantage. PRP is very painful sometimes because the solution itself is acidic. QR is neutral, so it's almost a completely pain-free solution, and you're not handling body fluids. And it is much more advanced. In head-to-head trials, the results of the QR678 were 300% more than the PRP or the GFC. That's why we recommend the PRP at the aesthetic clinics, and most of the partner clinics using the QR also suggest that QR should be used rather than the PRP or GFC. Preeti wants to know, my brother is a chronic smoker. After hair transplant, can he smoke? Well, he needs to decide very clearly. If he wants hair, he can't smoke. And if he wants to smoke, he can't have hair. Especially in androgenetic alopecia, when you have people who are smoking, it can cause a significant downregulation of the hair itself, and hair tends to fall even more. Why? because the smoke has nicotine that causes contraction of the blood vessels to the scalp. So as a result of which the hair do not get enough nutrition. As it is, they are falling genetically, plus it becomes even worse post the smoking. Post hair transplant, the wound healing can be a big problem because of these same reasons, and that's why we suggest that anyone who's getting a hair transplant or any surgery, give up smoking altogether at least a month in advance. So Vishruti wants to know, is the transplanted hair permanent? Yes, the transplanted hair is permanent, but there is a limit to the number of hair you can transplant, right? Because the problem is that the hair out here is limited. Vishruti, you can't remove beyond a certain level. And since you can't remove beyond a certain level and hair fall is a continuous process, today you'll do a transplant for the gaps which are there today. But tomorrow, if the gap increases further, you may not have enough donor hair to transplant it. So yes, the transplanted hair is permanent, but there's only a limited amount of hair you can transplant. Typically, in grade 7 alopecia, when there is only this strip of hair which is remaining in men, the person may have lost about 70 to 80,000 hair, but we will transplant only 7 to 8,000. So the transplanted hair is actually only 1/10 of the natural hair. So it's like a man-made forest. The man-made forest gives an illusion of fullness as opposed to the natural forest which actually is full. So Khushi Mangi wants to know, does drinking and smoking damage our hair follicle? Not so much drinking. Drinking is not so bad, but smoking definitely. As I said, it reduces the blood flow to the hair follicles. Usha Rana says, I am in South Africa and the doctors here are only doing their PRP. That's not true, Usha. Dr. Deepa Prabhu, who's in South Africa, plus a couple of other doctors, I can't remember the clinics, but they are key opinion leaders of QR678. So the QR678 is available in South Africa as well. So Harshal is like, how to maintain your hair post-transplant or during the QR treatment? See Harshal, once a patient, always a patient. Look at hair fall like a genetic issue. And any genetic disease like diabetes, as you are aware, does not have any treatment per se. It needs to be controlled, it cannot be cured. So like in diabetes, you have to take your treatment daily. Similarly, to maintain your hair post-hair transplant or during the QR treatment, you'll have to use some lotions and tablets throughout your life. If you don't, then over a period of time, your genetics will take over and you'll lose all the hair which had grown. So interesting questions. Srujan wants to know, what is the secret behind your face glow? I think that's the nice ring light that I have in front of me. So Rhizome Apex wants to know, sir, how can we know if our follicles are live or dead? So that is not something that you can know. That is something that doctors will examine. But even we, with our experience, sometimes can't tell whether the follicles are dead or they are dying. And so it makes sense to be starting the treatment and see if those follicles can get revived. That's why we use treatments like the US patented QR678, which can convert the dying hair into living hair again. Usha Rana, where can I get it? Dr. Deepa Prabhu actually talks of the QR678 treatment on her Instagram page very regularly. So it's not true that no one advertises the QR treatment. That's completely untrue, Usha. Obviously, I can't share numbers. I don't have numbers myself and I can't share numbers here. You'll have to look up Dr. Deepa Prabhu either on the internet or on Instagram. So Ekta Vish wants to know, will I be able to swim and enjoy other physical activities after my, what is that? I mean, is that after my hair transplant or after my hair transplant? Okay, yes, after your hair transplant, you can't do a swimming for about 3 weeks or so. But after that, as long as you're wearing a good cap, which protects it from the chlorine water and also washing it regularly and keeping it clean, there's no reason why you can't swim. Of course you can swim. Any other questions? So all in all, hair transplant is a significant advancement, but obviously it's not the holy grail. There are a limited number of donor hair behind. And the first thing that you need to know is you need to be on treatment throughout your life with or without the transplant. If you have genetic or hormonal alopecia, because otherwise your genetics will cause the hair to get lost over a period of time. Any other questions that we can take? FUT, we spoke about FUT, we spoke about FUE, we spoke about growth factor concentration, we spoke about PRP, we spoke about QR678, we spoke about all the advantages of hair growth, hair fall, etc. We spoke about considering hair fall or androgenetic alopecia a chronic problem. We spoke about all of that. So all of that has been covered pretty well. Usha, there's no evidence that the laser helmet works. Laser helmets are actually low level diode lasers, and there's no evidence that it works. I mean, a lot of things can be used, but there needs to be evidence that it works, and the evidence is not there that the laser helmet is useful at all. It will not. Usha Rana, you can continue to use the laser helmet till the cows come home, till the end of the next century. It will not make your hair grow thicker. No, male pattern or female pattern baldness is not caused by anything you're doing. It's just your genetics. It's just your genetics and your hormones. It's like, is diabetes caused by what you're doing? To some extent, yes. To some extent, yes. But mostly it's genetic, which means that if your genetics are predisposing you to diabetes, even the greatest care may not be able to help you. You will still go ahead and lose your hair genetically. It's like the soil or your internal genetic code has a problem, because of which the hair starts to fall. So it's a chronic disease like any other genetic problem. Can QR678 be done after hair transplant? Yes. So first we do QR678 and try to prevent the hair transplant. If that is possible and the hair comes back, then good, you don't need a surgery. So the QR678 is much cheaper, it's less invasive, it's a good thing. After that, if there are still gaps remaining, we can do the hair transplant as well. And after the hair transplant, to maintain the natural hair, some form of therapy will be required, as I'm explaining again and again. So the QR678 is needed to be done, can be done even post the hair transplant. Preeti, for any chronic, any genetic disease, you need to be on medication throughout life. Unfortunately, most patients don't know this and most doctors don't explain this. So if you have a hair fall problem, like if I have a heart problem, bypass surgery is not the solution. Bypass surgery is a temporary solution. Similarly, hair transplant is a temporary solution. It will fill up the gaps for today. If you don't take medication, the natural hair will continue to empty out, and therefore you need treatments throughout life. So Preeti, now the QR678 is regulatory approved by different regulatory authorities in 10 plus countries. And because it is approved in 10 plus countries, it is available in 1000 plus clinics in those 10 plus countries. In India itself, there are 500 plus clinics who are using the QR678. So the aesthetic clinics, of course, is the propagator or the... So there are multiple clinics where the QR678 is now available. Of course, for someone who has increased hair fall due to a change in environment, those are actually the easier ones to solve. If it's not genetic hair fall, it's actually easier to solve, and the QR678 can work in those, especially also in patients who have COVID. So from that perspective, both those situations work really well. Will your transplanted hair eventually fall out? No, your transplanted hair won't fall out, but the transplanted hair is in between the natural hair. So if it's in between the natural hair will continue to thin out. And so over a period of time, if you don't take the treatment, you will have a situation where gaps appear in the transplanted hair and you appear like you've lost much more hair. That is just the disease process. It has nothing to do with the transplant. Ekta Vish. So Usha Rana is asking, is the treatment QR the best for now? Well, that's why it has a US patent. That's why it has an Indian patent. That's why it is regulatory approved in 10 plus countries. So we don't know whether majority of the things work or they don't work. But we should believe only those things which have been accredited, which are patented, which have been approved by FDAs of different countries, and the QR is all of that. Yes. Can the QR678 reconstruct the hairline? Yes, up to certain extents. However, if the hair has already gone till here, then it's impossible to recreate the hairline just with the QR. In which case, we suggest a combination of taking hair transplant from behind and creating the anterior hairline and using QR678 to thicken the rest of the hair out here. So it's a combination therapy which is suggested, Aditi Meena. So all in all, I think we've had a decent time chatting. It's almost 1:28. I possibly have time for only about a couple of more questions. But in general, we spoke about a lot today. Thanks for joining the live. And thanks once again for allowing us to speak to you and taking care of your hair. We run a chain of clinics called the Aesthetic Clinics. We are in 4 centers in Mumbai. We are headquartered in Mumbai. But we also have centers in Delhi, Bangalore, Hyderabad, Chennai, Ahmedabad and Kolkata. So we are in 6 other cities besides Mumbai. So 7 cities totally in India. The Aesthetic Clinics is one of the initiators, or the research and development team of the Aesthetic Clinics gave rise to the QR678. And this QR678 is something which is now available in 10 plus countries and has treated 100,000 plus patients for hair growth. We are a surgical group. There are doctors who perform all types of surgery, but we also perform non-surgical treatments like Botox, fillers, hair rejuvenation using QR678, etc. So if we are in your city or you want us to assist you in any way, please join the Aesthetic Clinics and allow us to take part in your care. Unfortunately, Aditi, this is not about cosmetic surgery. We will hold a live about cosmetic surgery shortly. Thanks for all your interest, and thanks once again everyone for signing in. And this is Debraj Shome, and thanks on behalf of the entire Aesthetic Clinics team for signing in. Thanks a lot. Bye for now. See you. Thanks for joining.